Is that as time goes on, an increasing number of cases on your dockets are turning upon the application of scientific principles. Another is that recent decisions of the Supreme Court have imposed new duties on you, gatekeeping and decision-making duties that require an enhanced understanding of the scientific methodologies at issue in your cases. The goal, of course, is not to turn you into scientists. I can only respond that I think it is a journey you must take.
My name is Dr. Mary Case. I practice primarily as a forensic pathologist. We provide evidence of crimes and all sorts of information about how individuals died. And we do that primarily by doing this autopsy examination to determine basically, for example, the cause of somebody's death. Society wants to know when somebody is murdered, but they also want to know, for example, if there is a dangerous product that is causing somebody to die, if there's an infectious disease that might be a public health threat. Many types of deaths are only known about because the medical examiner or the forensic pathologist is the one that first finds out that, hey, these people are dying, so how can we prevent those individuals from dying?
I pulled the sheet down and he didn't have any clothes on. And there wasn't one part of his body that wasn't covered in a bed sore. Not one part. His elbows was dreadful. And he was so thin. And I got so hysterical and I ran out of the room into the office, and there was a nurse there, I think, and I said to them then, "What are you doing to my little boy?"
The nurses told Mrs. McKay that everything was all right, just to go home. So she did. And she's lived with it ever since.
And I just turned the key in the front door and the phone rang. And my husband answered the phone, and it was Matron, to tell him that Craig was dying and that we'd have to make our funeral arrangements that night because, being a small hospital, they had no facilities to keep his body.
You also tend to see a lack of leadership or administrative support at these facilities. Employee morale tends to be poor. You have an absentee medical director. There's a case I'm working on right now with really horrendous types of abuse going on. And I keep looking at it saying, where's the medical director? Why hasn't he been in? Why isn't he addressing some of these issues? And the answer is, nobody ever sees him. And that's a very bad sign and a real setup for abuse.
Debbie, come see this. His lungs are congested and his eyes are discolored yellow. Yeah, the breathing happens because the lungs can't clear the phlegm. The eyes. Could be kidney dysfunction. His temperature's up. I'll page Dr. Hackett. Well, he hasn't called back yet.
Well, what about another doctor?
No, they get really annoyed when it's not their patient.
Debbie, this is serious.
Dr. Hackett, this is Debbie. It's Mr. McCarthy. He's showing discoloration of the eyes. His lungs are clogged. Yes, Doctor. Yes, Doctor. He said those are normal symptoms. He said don't worry.
Dr. Hackett, it's the clinic again.
So tell them I'll call them back.
They did say it's urgent.
How many we need, Mark? Yes, what is it now?
Dr. Hackett, this is Maggie. Mr. McCarthy's condition is declining. He's not passing urine and his stomach is draining brown fluid, indicating internal...
Yes, thank you, nurse. I know what that indicates.
Let's talk about some examples of neglect. People who are lying in their urine and feces for extended periods of time. People who develop malnutrition, dehydration, pressure sores because they're not receiving appropriate care. People who are really in filthy conditions. They may have elongated nails. They may be living in a very dirty environment. There's really no excuse for this, and these are all signs of possible neglect. There's also the phenomenon of what I refer to as the great facility, one bad egg. You can have a really terrific facility, and a lot of then administrators, medical directors think it's not possible for abuse to occur here. We really work hard to do a good job. You have a reasonable staffing ratio, the administration is good, there's high quality care, and then unbeknownst to everybody, a sociopath gets hired.
For those who do choose to report, they do face certain kinds of legal potentialities. One might be a medical malpractice lawsuit, another might be licensure actions by a state, and sometimes even criminal liability.
It's just not enough to say, you know, okay, don't blame the person. You know, I kid around and say that, you know, people say, oh, they violated the procedure, they're bad, and then we say, well, don't blame the person. They go, well, they violated procedure and they deviated from normality or something like that, and our remedy is going to be we're going to send them off to procedure following class. And
this is a quotation from the Roman or Greek physician Galen, who was well recognized in his day as being an expert physician. He wrote as follows about the treatments he provided. All who drink of this treatment recover in a short time, except those whom it does not help, who all die. It's obvious, therefore, that it fails only in incurable cases. His excellent reputation may have very well been built on the logic implicit in this, because we have here a hypothesis that could not be falsified. There was no way of disproving this. The essence of what we do in science and in epidemiology is to develop hypotheses that we can test and either confirm them or refute them, and this is an essential.
Maggie, you must understand that without me, these people would be at the bottom of the barrel. Shooting them would be their only other option. Forces of madness are all around. You think that's arrogant, do you? Then what the hell are you doing here? Who asked you to save them, Maggie? Did anyone ask you to save them? I know you took it upon yourself to save them for their own good. You see, Maggie, you and I aren't that different. We both want to be on the right end of history.